Today, we're basically playing the role of medical detectives. We are going to decode the ancient Ayurvedic understanding of obesity, track down its hidden root causes, and then break down exactly how they treated it systematically. We're looking at a truly fascinating source document here, one that bridges literally thousands of years of medical observation right up to our modern metabolic crisis. It's going to be a great one.
All right, Section 1, the Global Obesity Challenge. According to the source material, as of 2022, 1 in 8 people globally are living with obesity. That is a massive, urgent health burden. Just looking at India alone, you've got 135 million individuals living with obesity, and the prevalence of abdominal obesity there, it's incredibly high. We're talking 40% in women and 12% in men. So this isn't just some modern inconvenience, right? It's a full-blown epidemic, and it's inextricably linked to a whole host of other serious issues like diabetes and heart disease. Now, Ayurveda actually has a very specific name for this condition, Sthaulya. And what's super interesting is that they don't just define it as simple weight gain. It's described as an abnormal accumulation of Meda, which means fat, and Mamsa, which is muscle tissue. But here is the crazy paradox that the ancient texts point out. Despite this massive increase in body bulk, there is absolutely no proportional increase in energy. In fact, it's the exact opposite. A person with Sthaulya actively lacks enthusiasm and suffers from general debility. You literally have more physical mass, but you actively lack the vitality to use it.
Moving on to Section 2, uncovering the root causes. So how does this happen? Well, Ayurveda doesn't just point the finger at bad food and call it a day. It actually looks at 4 distinct categories of causation, which they call Hetu. First, you've got Ahara, or dietary habits. Think overeating or eating again before your last meal is even fully digested. Second is Vihara, your lifestyle choices. Things like a complete lack of exercise or taking naps during the day. Third is Manasika, which are psychological factors. And this is wild, but an extreme lack of worry or just being way too comfortable can actually contribute. And fourth, and this absolutely blows my mind for texts written centuries ago, Bija Swabhava. This translates incredibly closely to genetic factors or chromosomal defects that literally predispose someone to obesity. Let's zoom in on those dietary causes for a second. The source beautifully illustrates this core Ayurvedic concept that like increases like. So heavy, sweet, dense foods, things like excessive sugarcane, heavy dairy, dense meats, they literally share the exact same properties as fat itself. When you consume dense, heavy foods, you are directly fueling those dense, heavy tissues in your body. And you know that habit of snacking on the couch before your last meal is even digested? Yeah, that's a major culprit. It just completely ruins your metabolic fire. Section 3, the vicious cycle of fat. Okay, this pathogenesis, they call it Samprapti, is honestly the most fascinating part of this entire explainer for me. It reveals this vicious, completely mechanical cycle. Here's how it works. Step 1, all that excess fat physically obstructs your body's internal channels, known as Srotas. Step 2, because those channels are all blocked up, Vata, which is the energy of movement, gets totally trapped in the stomach. Step 3, this trapped air dangerously spikes your Agni, your digestive fire. Think of it like wind blowing on a campfire. Step 4, this spiked digestive fire causes rapid digestion, which creates an intense, insatiable craving for more food. And finally, step 5, you overeat to satisfy that unnatural hunger, which creates more fat, which blocks the channels even further. It is just a brilliant, logical explanation of the actual mechanical trap that makes it so ridiculously hard to stop overeating once obesity sets in. Section 4, do's, don'ts, and diet. So how do we get out of the trap? Diet is your first line of defense. Notice how the strategy here is replacing heavy, dense habits with light, what they call scraping ingredients. For the do's, the text highly recommend old rice, barley, mung beans, and warm water. And a really surprising remedy, honey. Honey is heavily recommended because it has these unique scraping properties that actively help clear out fat from those blocked channels. As for the don'ts, you have to absolutely avoid newly harvested rice, heavy dairy, and this is a big one, absolutely no daytime sleeping. Napping during the day severely aggravates fat storage. Section 5, yoga and physical action. But diet is only half the battle, right? Treating obesity requires getting the body moving so we can clear out those obstructed channels we talked about. Integrating specific postures, like sun salutations, actually helps burn that excess fat. Breathing techniques, like Bhastrika, are amazing because they stoke a healthy metabolic fire without trapping the air in your stomach. And it's not just physical. The source notes that meditation and observing ethical disciplines are absolutely crucial to pacify the wandering mind, which brings control right back to emotional eating. It's a true, full-spectrum mind-body intervention. Section 6, clinical Ayurvedic treatments. Now, for more severe cases, we look at the clinical side. Because Sthaulya is fundamentally a condition of excess, the primary clinical treatment relies entirely on Langana, which means lightening therapies. And this is a bit counterintuitive to how we sometimes think about medicine today. You do not treat this with heavy, nourishing, building treatments. You have to treat it with scraping, drying therapies to actively reduce the fat. For stronger patients, this includes Shodhana, which are intensive purification therapies designed to forcibly clear out those obstructed channels. I love how logically these clinical interventions scale up depending on the severity of the disease. At level 1, it's pretty straightforward. The patient receives specific oral herbal medicines like gugulu, which is famous for its fat scraping properties, alongside strict diet controls. But if the condition is more stubborn, they step it up to level 2. Here they introduce basic panchakarma therapies like udvartana. That's this intense dry powder massage that physically breaks down subcutaneous fat, and they pair it with specialized medicated enemas. Finally, for morbid obesity, we hit level 3. This involves deep, intensive purification like therapeutic purgation to literally reset the body's entire metabolic system. So, let's bring it all together. We are facing a massive modern epidemic right now. Yet thousands of years ago, Ayurvedic physicians had already mapped out the exact mechanical trap of fat blocking your channels, spiking your hunger, and creating this brutal, vicious cycle. They didn't just point out the problem. They provided a beautifully tiered, logical system of diet, movement, and clinical purification to actually fix it at the root cause. I want to leave you with this. Consider how blending this deep traditional wisdom with our modern healthcare routines might just be the exact key we need for lasting wellness.